In the past few years, the Ministry of Health embarked on the journey to strengthen the country's ambulance system, a critical component in responding to emergency health care services.
The national ambulance system used not to exist. It has now been established. And it was made clear by approval of policy by Cabinet in 2021. So we have now the right to have the system established throughout the country. Second to that, we got a vote from the Ministry of Finance for the National Ambulance Service. It is now at about 4 billion shillings, which we get to run the National Ambulance Service. But of course, we have had to make estimates of additional monies. The third strength is that we have had the structure for establishing ambulance services approved by Ministry of Public Service.
There are 3 classifications of ambulances, and these include Type A, that is just a transport ambulance to deliver the patient to a health facility. Type B, that has basic life support, such as oxygen, and Type C, that has advanced life support with more equipment, and this is used to transport critically ill patients. The ambulance system covers the 3 areas that include road, marine, and air. Although important strides have been made, there is still need for more investment to, among other things, strengthen coordination of the system, procure more ambulances, increase funds for fuel, maintenance, repair, and train more ambulance staff.
Strengthening the ambulance system looks at a lot of things. Looks at the physical aspects of the ambulance vehicles themselves. It looks at the people who work in the ambulance, the equipment in the ambulance, and the communication between the ambulance and the community, or the community and what we call the dispatch centers.
The country has 353 constituencies, so for universal coverage, we would like each of those to have at least one Type B ambulance or basic life support ambulance. Then we have regions. We would like each region to have one Type C ambulance or advanced life support ambulance, and then coupled with a basic life support.
The country has 276 ambulances against the required number of 516, ideal to cover road, marine, and air. The ambulance coverage at constituency level is 181, with a gap of 172. Regional and national level is 40, with a gap of 12. Marine ambulance coverage for island and large water districts is 14, with a gap of 6. And civilian air ambulance or aeromedical ambulance coverage is 0, and the gap is 6. Other gaps are in disaster response ambulances, highway ambulances, medical command, and highly infectious disease isolation ambulances.
Like when we have highly infectious diseases like viral hemorrhagic fevers, Ebola, Marburg, and so on. These require specialized ambulances which have negative pressure, where even if you had a patient within the patient cabin of the ambulance, they cannot spread infection to people who are taking care of them, and we call those negative pressure ambulances.
However, there is some progress towards strengthening the ambulance system in the country now with the creation of call and dispatch centers. The case in point is this center located within Naguru Hospital and has 5 ambulances to serve Kampala Metropolitan, that includes the districts of Mukono and Wakiso. On average, this call and dispatch center receives 15 to 25 calls in a day.
When these calls come in, we have what we call call takers who help us to triage or to select patients that are most in need, so that eventually we get into the system of the dispatch, where an ambulance is called to be able to receive the patient, and then the dispatcher gets in touch with the facility where the ambulance is going to pick the patient or the area where the patient is, and then the ambulance sets off, and during that time when the ambulance is moving, we have a medical provider who moves along to ensure that everything is prepared before the patient is reached, and when they are reached, they receive the emergency care.
The main challenge encountered is inadequate fuel to meet the demand.
It is possible for us to actually handle all. The only challenge we get is inaccessibility of fuel. The limitation is really on the fuel. The service providers are available, the ambulances are always there, but it's just the limitations in fuel, because we want to actually reach everyone who gives us a call.
A strong ambulance system helps to enhance the ability of public health services, respond to medical emergencies, provide timely referrals for patients in severe and life-threatening conditions. Mtonyi Hilda and Adia Nakuti, UBC.